International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Hi, thank you very much for the opportunity to do a video commentary of a written piece that I did for the journal several months ago. So my name is Katherine Quissell. I am currently a lecturer in health sciences at Boston University, and I wrote a commentary on the additional insights into problem definition and positioning from social science, which is a response to Jeremy Schiffman's editorial looking at the 4 challenges global health networks face. So what I wanted to talk about briefly before jumping into the core arguments of my commentary is why a focus on global networks is important for global health. And as Jeremy Schiffman outlines, one of the reasons why it's so important to look at these new entities is because they have been proliferating across global health. There's many different issues that now have global health networks working on them in terms of trying to raise attention and resources. So it's a really important phenomenon to look at in more detail. It's also, as a lot of people have pointed out, that this really is complicating global health governance, trying to figure out where decisions are made, who should be held accountable for what, whether or not there's enough representation of community voices, whether or not these entities are accountable. So there's a lot of big questions still remaining. But because of the diversity of global health, in terms of the number of different types of organizations, the countries, the intersectoral nature of health problems, this might be where and how governance is going to take place moving forward. So we really need a better understanding of who and what these networks are, what they do, and when they are able to have positive or even potentially negative impacts on policy and health. As I was mentioning, they have an important role to play in determining what issues get attention, what issues are neglected, how and what programs are promoted and where. But we haven't been looking at them in as much detail and with the same level of rigor as we have been assessing, say like the quality of specific intervention strategies. So I think this is one of the areas in global health where we're starting to look at it more. There's a lot of really good scholarship that's been working on it in the last several years or so, but it does need more attention. It's a really important issue to look at given its potential downstream impacts on health. So even though it's a newer area in global health, there is a decent amount of literature and scholarship in social science that can help in thinking through these problems. So a lot of it comes from political science work in governance, accountability, representation, stuff from international relations that looks at transnational advocacy networks, sociology. There's a lot on social movements, psychology, work on things like negotiation and persuasion. So these are all components that are important for understanding both the governance and the advocacy component of what global health policy networks are doing. So with Schiffman's editorial, he was looking at 6 studies from the Global Health Advocacy and Policy Project and 2 additional cases, so looking at 8 cases. These 8 cases largely draw from political science and sociology, and he synthesizes them to point out what 4 key challenges he sees global health networks as needing to overcome to be effective. So that's effective coalition building, effective governance, being able to achieve consensus on problem definition, and then being able to create an effective public positioning of the problem that will lead to policy change. So I'm going to focus on those last 2 components of problem definition and positioning because they're closely related to each other, also because I see them as important for the other 2, particularly coalition building. So again, starting from Schiffman's article, he describes and defines problem definition as how members of networks come to understand a problem and its solutions. I think that for the purpose of both analysis and planning, it's useful to think of problem and solution definition as separate, but sometimes related processes. So I'll describe that a little bit. So given the example of HIV/AIDS. So the HIV/AIDS community has been one of the most effective globally at raising attention for an issue and fundraising and leading to large-scale programs. If you look across this broad community, whether or not it's one network or multiple networks, I think is an empirical question, but you can see that there's a wide range of problem definitions. So just to give a couple examples, there are certain organizations and individuals who see HIV/AIDS as a problem of structural violence. others who see it as a problem of gender inequality, and yet others who might see it as a problem of, say, problematic sexuality or promiscuity. So you can see how, if they're tied together, these problem definitions would lead to very different types of solutions. So if you're concerned with structural problems, economic development might be the solution you'd want to promote. If you're concerned with gender inequality, it might be targeting women's empowerment. If you're concerned with promiscuity, you might be promoting abstinence education. So you have this really, really diverse problems that are people who see the problem in very different ways. And yet this community, in large part, was able to achieve consensus on antiretroviral treatment as the primary solution. And that might have been because of all of the disagreements around these other types of solutions. But basically, this is to argue that you can have a wide range of problem definitions, and that doesn't necessarily mean that your network can't be effective. It does mean that you need to think through, where the disagreements you're having lie and whether or not you could, say, achieve consensus on a solution that can meet the needs of multiple different perspectives or organizations. And this is an interesting strategy because there's a lot of evidence that diversity in networks is a strong benefit. Diversity tends to bring in a lot of different information, different ideas, but it does pose a collaboration and governance challenge. Like, how do you manage so many different perspectives? So that could potentially be done through solution consensus. So it's important, I think, for network members to think really critically about these disagreements they're having and whether or not there's places of compromise, or as the negotiation literature would describe it, zones of possible agreement. So it's not necessarily an easy thing to accomplish, but it's worth engaging in because that can mean for more effective advocacy if you have one clear solution to promote to governments around the world. Again, when you then move into this issue of trying to position it for external audiences, trying to target ministries of health or donors, there's a lot of evidence that suggests that networks typically rely on problem and solution definitions that they create internally for their external positioning, and not necessarily on the way that their targets see the issue. And that's potentially problematic because there is a lot of research in social psychology in particular that shows that framing issues according to how target audiences see it increases the likelihood for learning, alignment, and persuasion. So in order to do that, advocacy networks need to use what's called strategic framing. So they need to be able to think through how their target audience sees the problem and then frame it accordingly. And so the more time that these networks spend working on broadening their coalition, bringing in new network members, overcoming internal disagreements, the more prepared they will be to do this externally. But it also requires more in-depth looking at target audiences and how they see problems and solutions. And again, not to make this sound easier than it actually is, because being able to strategically frame issues will be more or less easily done depending on a variety of factors. So for example, issue characteristics. Some issues are more difficult to frame persuasively for target audiences. And there's a body of scholarship in political science that looks at target population characteristics and the impact that has on government willingness to advocate resources. So for example, in this framework, they look at groups that are seen positively and negatively in society and also the level of political power these groups have, finding that groups that are seen negatively and that have constrained political power are much less likely to see policy benefits than groups that are seen positively and have access to the political process. So this is something that advocates have very little control over unless they are somehow able to change the social valuation of the groups whose health they're trying to improve or to work on, or potentially to strengthen the political power of these groups. And so this clearly requires much more substantive social transformation. It's not just a marketing exercise. It's not a simple biomedical solution intervention. It requires much more than that. So depending on that particular issue characteristic, this can be more or less difficult for advocacy groups. It also could be compromised or could be challenged by, again, the diversity of these networks, is if there's strong differences of opinion that are based on ideology. Differences based on ideology or morality are much more difficult to overcome than other types of disagreements. You might see network members that have different short-term versus long-term goals, but in all of this, it's my argument basically is that it's worth discussing openly, to get it out at the table, to figure out where these disagreements are, to see whether or not there's any opportunity for compromise. And then to think through, too, the consequences of framing. To use, again, the example of HIV/AIDS, one of the things I looked at in my dissertation work is that there's a very prominent framing of HIV/AIDS as a problem of women's vulnerability. And this has some benefits and some downsides. So one is that it recognizes gender inequality, and it recognizes the real risks that women face in terms of gender-based violence, in terms of their constrained ability to control sexual relationships. So it raises, an important social problem in the context of HIV. It also infers innocence on women, because if you say that they're vulnerable, it means that they're not necessarily responsible for getting HIV or for the acts that lead to HIV. So that does mitigate some of the stigma. So you could see that as a way of improving women's social valuation. But the other consequence of it is that, women are clearly getting HIV somehow. And so that's from heterosexual men. So now what you've done is you've also created a guilty group. Stigma hasn't really been fully addressed. It hasn't gone away. It's just been deferred or deflected onto this other group. And the reason why that's problematic is that we clearly know that not all men with HIV are violent. Not all men with HIV are, having unconsensual sex with their partners. We know that they are also less likely to seek out testing and treatment services generally. And if this narrative is really dominant in countries, it's certainly not going to help men in terms of accessing the testing and treatment services that they need. It's also potentially problematic for women who don't fit neatly into this vulnerability narrative. How would these women be treated if they go in for healthcare services? And it's just to point out that, women do make up the majority of people living with HIV globally. It's about 51%. But currently, men make up 58% of AIDS deaths. So there are gender issues that we need to think through and think about, the balance of how we talk about things like violence against women within the context of AIDS, how we talk about vulnerability, and who we include in that discussion of vulnerable groups. So there are consequences of framing that networks need to think through. So basically, to conclude, that problem and solution definition and external positioning are very important issues, and that there's a lot that we are currently able to learn from existing social science scholarship. There's a lot left to study because we don't know if a lot of these ideas and theories really carry out in global health, because global health is just different from a lot of the different types of areas that have been studied. So there's a lot of questions left to answer. I outlined some in the written commentary that I did. So if there are practitioners or scholars who are interested in addressing any of these, if you have any questions, I can absolutely, refer you to citations to sources beyond what I cited in my initial piece. But if you're also interested in doing any sort of prospective joint research, please let me know. Because one of the follow-up studies that I would like to do is to actually do advocacy as a form of research to see whether or not strategic framing can lead to quicker policy adoption. So that's just one of my, prospective ideas that I would be happy to talk to other people about. So thank you again for this opportunity to do the video commentary. I really appreciated being able to engage with Jeremy Schiffman's piece and the opportunity to write my own. Thank you again. Bye.